The National Agency for the Control of AIDS, NACA, has called on the media to partner with the agency as it works towards eradicating HIV/AIDS in Nigeria by the year 2030.
Our mission in NACA is to make Nigeria a nation of people with functional knowledge of HIV who provide care and support to individuals, families, and communities confronted with the epidemic. NACA is the sole statutory agency authorized to facilitate all stakeholders' HIV and AIDS activities in the country. The mission of NACA brings me to the purpose of this workshop. We all know that social media has become an influential platform for shaping public opinion. It can play a crucial role in reducing the spread of HIV and AIDS virus and combating stigma and discrimination by being equipped with adequate knowledge and understanding to help reduce the spread of fake news, misinformation, and misconception on HIV and AIDS and other related diseases. Our aim for organizing this workshop is to solicit your support to achieve this mission by being our advocate on social media and traditional media platforms in ending AIDS by the year 2030. We believe this is doable. Please join us in fighting this to finish in Nigeria by pushing for the last mile.
When you talk about HIV/AIDS, people know exactly what you are talking about. However, when you talk about prevention, when you talk about treatment, when you talk about risk factors, when you talk about stigma and discrimination, when you talk about barriers to people knowing about their status, and when you talk about one important thing that has denied us that opportunity to bring AIDS to an end over the last 20 years of active fight, people are not aware about it. I want you to pass the message across as we expected. We want people to know that HIV, even though it doesn't have cure, but is something that no longer kills now any longer, and is one disease that you can manage and manage successfully. People have been living with this virus now, some for the last 30 years, some more than 30 years, because HIV is more than 40 years. However, we want people to understand that fighting HIV begins with you. And we have had opportunities to engage different population groups. One population group that has been hard to find and very difficult are the adolescents and young persons. We believe social media influencers have an age and will help us connect to this important population the way we want to be connected with. People should understand that if you have HIV today and you walk into our facilities and you demand for that HIV service, you're doing not only good to yourself, but you're doing good to all of us, because you are helping us to control HIV without us putting money to go after you, to get you to the facility and to get you treated. And this is what we want. We want people to begin to demand for HIV services instead of us going after people looking for them to get tested and looking for those that are HIV positive to come for treatment. Why this is important? Because as we approach 2030 and we identify close to 100% of those that have the virus among us, the few 3-4% may not be able to get using our conventional way where we go out community after community to get people. No. We can only get that 3 to 4% if people develop the culture of demanding for the service. So we want people to demand for HIV service, to demand to know about their HIV status. And if they are HIV positive, we want to see people demanding for treatment services. Because people live with the virus long, if you look at our data, you find out that the vast population of people living with the virus are those that are around the age of 34, between the age of 34 to all about 40 years. And this is easy to explain. The last 10 years, the last 20 years, we have succeeded in reducing HIV from disease that kills to disease that no longer kills. So all these people that were 20 years, 15 years, in the last 10, 15 years, they're now 30, 35 years, have lived with the virus and are now counting to the larger pool. That is why when you look, you see them. But if you are looking at the infection and you're looking at the people that are getting the infection fast, so those are the people that are, 1, the age group is young, and 2, female population get the HIV virus more than male, and 3, people that are among those population we tag key affected population.